Well, it's 3 o'clock and it's Tree Talk. Here we are, Lisa.
Episode number 2.
Number 2. Scott Tardy, Lisa Tyversky. We're here from the Glenner Memory Care Centers. And we're streaming live on Periscope right now. So we hope to see some of our viewers jump on. And it's Super Tuesday. And we're excited to be here with you. So this is going to be an opportunity for us to kind of continue the dialogue that we started just last week. One of the things we talked a lot about last week was seniors and aging, right, Lisa?
Right.
I think one of the things that we tried to emphasize is just kind of the discussion about seniors and aging and give you some takeaways. And we have an exciting topic, I think, again today, in that there's a lot of folks that are looking for answers regarding options for senior care. So,
different options available. Yeah, and Scott, I just wanted to sort of recap what we talked about last time.
Absolutely.
Again, the purpose of this show, if you will, is sort of we're calling it our virtual newsletter rather than sending out a newsletter. If you missed last week, this is the background, but or our goal is to get information to you just sort of in a casual forum like this rather than sending it out online, and we want the information to be what you want to talk about. So that said, we had a lot of comments last week for people that wanted to know about different care options. They wanted to know details about the Glenner in particular, daycare in particular, and then other options that are available. So we've sort of geared today's show towards that. So that said, too, you probably noticed if you saw last time that we've gotten rid of the white halo.
That's right. It looks better.
Or the white afro from last time.
I think it looks better.
That was the feedback background. Most people, yeah. So the halo is gone.
That's right. We got a better shot this time.
Yeah.
I think we should have some better sound quality this time. So I think, this is one of those opportunities for us to really engage with our audience. We want to thank everybody that's been viewing our episodes online. Our Facebook page has jumped tremendously. It's jumped tremendously. Yeah, we're close to 800 likes now on Facebook, which is
in just a short
exciting
period of time, which is so awesome, and really great comments from last week. Thank you very much. We've just gotten great suggestions, great private messages, great posts. So it's been successful, and it's only week 1.
That's
week
right.
2.
Absolutely,
week 2,
absolutely. And producer Amber is off camera. She's here with us, and she'll engage in the conversation with us at different points as well. So if you hear her,
she'll give us the hook if we get repetitive too.
That's right.
So.
That's right. She's keeping us focused on the issues.
Okay, so let's go.
Topics.
Let's get into it.
Yeah, we're gonna jump right into the conversation today. And I think what we talked about, we posted online, if you saw, which was essentially when care is needed, what are the options, right? So, I mean, that's kind of the right off the bat, that's one of the things that we want to talk about. We want you to, again, post your questions, post your feedback. If you're watching this at a later point other than not live on Periscope, opportunities to engage with us. So remember, the email address is treetalk@glenner.org. Right? So they can always send us an email. We're excited to receive those emails. Remember, we have a 1-800 number that you can utilize as your resources as well at any time during the show or through our operating days during the week. That's 1-800-736-6674. Again, 1-800-736-6674. You can, again, find us on Facebook. You can find us on Twitter. And you can certainly visit our website, which we'd love you to do as well, which is glenner.org. So those are the ways that you can reach us. But yeah, let's jump right into this conversation.
Let's jump in. So I think our goal today was to talk about, generally speaking, the main the main levels of care, if you will, that are available. So if you're taking care of someone with Alzheimer's disease and you're not sure what to do, I think to kind of go in order maybe of how people kind of view things. So I think number 1 is to do it yourself, which a lot of people try to do, which might work for a little while, but it usually ends up causing a lot of stress and upset in the family. So again, you can do it yourself, or you could pursue adult daycare, which again is what we do. There's lots of daycares out there. The Glenner, of course, is the best. I'm just kidding.
We're a little biased.
We're a little biased, but anyway, no, we'll get into the details of what we do
right.
specifically at the Glenner in a little bit. You could go into assisted living, and there are options for assisted living if you need a boarding care, which is a smaller environment. And again, we'll talk more in detail in a minute, but that's usually somebody's private home where they have about 6 beds. And someone will manage the home and manage the individuals in the boarding care. Bigger assisted livings, for example, like an Elmcroft or active care is more of memory care, or a memory care community that is specifically for people with memory issues, and then skilled nursing facilities.
That's right. So Lisa just kind of gave you a summary of just really the different types of care options. So let's say you're watching right now and you are having questions about the types of care that are out there. So our main goal, like Lisa said today, is to give you some various pieces of information. I think one of the things we want to start off with is really just the description of the care. What are each of those levels of care look like? And then I think we want to talk a little bit about cost, and we want to talk about the insurance
then
coverage.
People are, how do we pay for this?
Yeah, because there's always the question, right, Lisa? I mean, people are asking us all the time, how do we pay for this? And unfortunately, in society today, for many reasons, typically cost and the challenge of essentially financing long-term care is very difficult. I think there's a combination of folks that quite frankly just don't plan for that, and then there are others that perhaps think about it, but the reality is that it's just out of reach for them cost-wise. So I think what we really want to focus on today is just giving you certainly the description of each. So as Lisa said, and I'll kind of jump in with the do-it-yourself piece. I think there's often times where folks are at home and they already, quite frankly, know that they need assistance. But the question then becomes, when is it time to look at other options? And I think there are some warning signs that typically will happen when you are looking at individuals at home. Perhaps you are looking at this for yourself. Perhaps you're looking at this for a family member. And I think when you start to see some hallmark warning signs, and I'll jump in with one of the ones that's right off the bat is often falling. Falling ends up being one of the number one reasons that individuals land up in the hospital, as well as many other medical reasons.
Or wandering
Absolutely.
Wandering is huge, because if you think you can do it at home and then you leave to go to the grocery store, or you go to work or whatever, and then they're gone. So that's
Right, and what Lisa mentioned is maybe specifically related to even to memory care and to Alzheimer's and dementia. So there may be various reasons that you're looking at this episode right now saying, you know what, Scott, you know what, Lisa, yeah, there's some warning signs already at home, and we kind of named a few there just in regards to a couple of types of situations that you might encounter. Oftentimes families are far away, and they come in and they will see individuals in their families for the first time in maybe 3 months, 6 months, could be a year. I've seen warning signs throughout my career where there's been things like spoiled food in the refrigerator. There's been times when there's checks, if you will, or bills that have been unpaid. That can be another warning sign. Then, of course, you're looking at when the couple, if you will, the husband, wife, or the family unit, if you will, is still at home, and the caregiver of the one individual is struggling because their health may be failing in trying to take care of their significant other. So there's so many different reasons that individuals are looking at at care needs. And again, the do-it-yourself, if you will, at home, quite frankly, is can become very problematic.
Yeah, I mean, it can work for a while, but after a while, well, a lot of people wait, I think, to seek care until something bad happens. And that's why we want to tell you about this, so we can sort of take preventative measures so that you aren't waiting until somebody falls or somebody leaves the house, and you can't find them. So let's jump into, I'd say, sure. And I don't know that I listed home care as an option a couple minutes ago, but that is also a valuable option, is hire people into your house. So let's start with adult daycare. Sure. I think that that's one of the easiest first steps that people can take if they're not sure, because your loved one will continue to live in the home, so it's not as traumatic for the family. It's not as expensive. So a daycare program, and I'll just sort of summarize what that is, because I do a lot of presentations around the community about daycare, and I'll say daycare or day program 5 times, but then somebody still raises their hand and says, how many beds do you have? So because I think it's a foreign concept to people. I mean, some people just think, oh, daycare for people with dementia. I didn't even know that was a thing. Sure. So a daycare program can be extremely valuable if you want to sort of start off with care, start off experimenting with having your loved one go somewhere else and being taken care of by somebody else. They, again, continue to live at home, so they still have the comforts of their own home. And then they get the socialization, the interaction during the day that is so important for their brain health.
So there's still, so just so our audience is clear, Lisa, so you're saying that obviously in day programs, an individual is going to be dropped off and picked up.
Right.
I mean,
dropped up. Yep. Exactly.
And it's similar, it's in its function to being able to have a structured day program throughout the day. So the individual's engaging in meaningful activities, they're getting provided a meal, and they're picked up at the end of the day. So this is an option if perhaps an individual is still working at home, or there is just not a way for there to be 24-hour care in the home.
Right. Again, yeah, first step, will provide a lot of relief for you as a caregiver. And then I think it's important to mention, when you're looking for a a daycare program, is to look for one that will have perhaps a nurse on staff. Mm-hmm. Perhaps it will help with medication management, because that's something that's really confusing for caregivers, is helping their spouse or their parent with medication. Sometimes they forget if they gave a pill, or it can be very overwhelming. A lot of times there's a lot of medication involved. So if you look for a daycare program that will help with medication management, which, by the way, the Glenner does.
Right, absolutely.
And we have an RN on staff
That's
at every location, I should say that. So, and then of course, then we need to look into how to pay for it. A lot of day programs are private pay. Some will accept Medi-Cal, some will accept VA, and some will accept long-term care insurance.
Right, which is important. And again, if you're viewing, I see we have some viewers now, so welcome to Tree Talk. And I think the conversation again that we're talking through is options for care. And so individuals that are looking for, and right now we're speaking specifically to adult day programs. And remember, in various states, and you'd be watching this throughout the United States or internationally, there are different types of licensing requirements and whatnot. But the reality is that we're looking at an adult day program that provides that structure for an individuals through the day, and really does provide an option for individuals that may not have any other option. And when we look at cost, I think you have to look at it almost like a continuum of cost, right? So I think, to some degree, individuals trying to manage things at home, they may think that there is no cost, but the reality there's a significant cost there as well. How that factors in, I think, depends on what care needs there are. But you look at day programming, you could be essentially just start going just a few times a week. Mm-hmm. You could go a couple of times a week. You could go half days. Prices range, I'd say, Lisa, probably from, you could spend as little as $500 a month, and not saying that's a small amount, but it's certainly as much, it's a less amount, if you were, than you would see in kind of more developed care programs. Or you could spend maybe up to $2,000 a month in various programs, going every day for full days. So I think that's a question you have to think for yourself in the audience, or if you're looking for a family member. Certainly budget plays into this. It is a reality. We on this show, and certainly in our organization at the Glenner Memory Care Centers, we want to deal in realities for our families and for their loved ones. We recognize that there are budgets. Not everything is covered by insurance, and so, as Lisa mentioned, in day programs, you have the VA, which is Veterans Administration, right? You have some private insurance companies. You have some government programs. In California, it's called Medi-Cal or CBAS. In other states, it might be called Medicaid. So you have to look at those options for yourself in regards to insurance. But as Lisa very accurately said, I mean, there are some key pieces to a day program that could be very beneficial, including medication management, including having a nurse see your loved one each day. So those are some of the things that you could look at right away. But
another thing that a lot of families do is they'll combine home care with daycare. So daycares are usually open Monday through Friday for 8 hours a day. So there's 24 hours in the day. They need more care. So a lot of families will have the home care agency bring them to the day program, or care for them in the morning, bring them to the day program perhaps for half a day. And then pick them up and bring them home and take care of them at night. So there's a lot of ways to combine home care services and adult daycare services.
That's right. And we can just, it's a great segue that Lisa made right into home care services. So, again, some individuals may still look for 24-hour care at home. There are some very affordable options in regards to that, maybe perhaps non-medical services that can be provided. Typically, you'll see those on an hourly basis. I've seen cost range anywhere, again, depending on the market, from $10 to $20 an hour for non-medical care. And then I think that, and those are things like errands assistance, those things like that. Again, more of the hands-off approach, which again may not be appropriate for the care needs that you're looking for. And then you can go all the way up to 24-hour care, which could be,
and medically assisted care and help
absolutely.
with bathing and toileting, and
which could be upwards of several $1,000s a month. Right. It could be, if you're talking about 24-hour care, it could be $10,000, $12,000, $15,000, $16,000 a month. But again, it could be a fraction of that if you're just looking for some supplemental care during the day. So again, I think one of the things, if you're looking at this, and I think we said last week, if you're jotting down some notes and taking some information, almost you break it out from that perspective. So already we've talked about home care, we've talked about adult day programs, and then I think we jump into more of a developed care plan, if you will, when someone really is looking at residential programs. So Lisa, let's talk a little bit about residential programs, and we broke it down into 3 categories. Essentially, you have a board and care, which is a kind of that first level of residential care, right? So again, if you're first hearing about this and you're saying, Scott, I don't really understand what's a board and care. So you're talking about a home that's in a residential neighborhood, right? You wouldn't even potentially know.
And they're typically very small.
Correct.
Yeah, you wouldn't even know driving by that they're a community or a
that's right.
board and care, yeah.
You would have no idea that it potentially is a board and care.
Right.
And those communities could be 6 beds, they could be 8 beds, they could be 12 beds. You're probably not going to see something much larger than that in a residential neighborhood. That is an option for individuals.
I mean, some people like that. Some people don't want to be in a big, fancy community with 100 people or 100 rooms. They want to be in a small location. So that's a great option if you're looking for residential. So, and then into these. Yeah,
I'm sorry. Yeah. So and we can talk about the pricing on that a little bit. Yeah. Just kind of, typically you're looking at. It could be as low. I've seen as low as supplemental security income rates. I've seen as low as $800 a month for those.
Oh wow, that low.
Absolutely, absolutely. Good. So and that's if you think about it, it's a tremendous need and a tremendous gap that exists in the community. So you want to do your research, right? You want to make sure that you're selecting a board and care that is certainly a reputable organization. I think we always stand for doing your homework. I mean, that's critically important in any business and any consumer-driven product, and so that can typically be a good option. Those are licensed. They are licensed communities, but again, I think we do certainly advocate for people to do their homework and look at those types of organizations and see if they're a good fit for them. But price range can range again from several $100s to several thousands of dollars depending on the type of community. And then we go into, Lisa and I were talking earlier, just kind of call more like the big box assisted living communities, right? These are the large organizations, and they may just have 1 or 2 communities, but they are...
Or they could be nationwide.
They could be nationwide. And they could have, 50, 60, 75 individuals that live within a community, or it could be several hundred people that live in a community. Again, like Lisa said earlier, just depends on really what you're looking for. If you're looking for a smaller environment, perhaps a board and care is a better option for you. If you're looking for a larger environment with more interaction, with a lot more people, perhaps
But you're right. There's smaller assisteds. There's big assisteds. I mean, that's why it's important to go tour them and find out also what they can accommodate. Because if we're talking about memory care here, there's a lot of assisted livings that don't accommodate memory care.
That's right.
There are a lot that do, and then there's some that don't. So that's very important to ask questions when you're touring them.
Very important, very important. And I think in future episodes we'll get into even, if our viewers would like to hear more about some of the questions that you can ask, there's definitely an opportunity to ask questions and engage and understand more about the staffing ratios and the types of care that's provided, because this is one of probably the most significant decision that you're going to make in regards to care decisions. There are only so many large life decisions, right? And I would definitely qualify these kinds of decisions as right up there. I mean, it's important.
So let's go back to, for assisted, we're talking about just the general environment, and then let's talk about cost a little bit and how to pay for it. So I know you could probably give us some guidelines.
Absolutely. And I think one of the things in regards to, you're looking at cost is, you're going to look at things just like you would in normal real estate type transactions. You're going to look at location. You're going to look at the type of community, is it more of an economical option, if you will, or is it more of a resort style, higher end community? What kind of food is being served? I mean, there's many questions in regards to making assisted living choices that you're looking at. So I think, back to Lisa's question, the range can be anywhere between, in a large assisted living, I think your kind of entry level is probably going to be more like $3,000 or $4,000 in a kind of a California market, if you will. I think in other environments you might see a little bit of a difference there. You can go all the way up, right? You can go $5,000, $6,000, $7,000 depending on. Oftentimes there's levels of care and things like that factor in to the pricing. So
that can add up. So that is that's really a good point. Is you want to ask if there's a tiered pricing system, because they'll charge sometimes for different, like Scott said, different levels of care or medication, dispensing medication, different services. So if you're getting, if your parent or your spouse has higher needs, it's going to be a lot, it's going to be a lot more expensive. And then there's some that are all inclusive. So those are the questions you want to ask when you're touring.
Yeah, these are really important questions, and I know we're throwing a lot of information. It's a lot, right? I mean, so we're talking about, again, we're talking about home care, we're talking about adult day programs, we're talking about assisted living, and then kind of a breakout of assisted living programs, whether it be memory care, whether it be a board and care, whether it be a large assisted living communities. And then I'm going to throw one more into the mix, which is skilled nursing. So you've got an opportunity now to kind of talk through skilled nursing, which you might be saying, okay, Scott, Lisa, I mean, you already threw basically four different types of care at me. Now you're throwing a fifth level. And I think skilled nursing, we're talking about more of the true 24-hour required care, right? This is individuals that truly need kind of a skilled level care, where you're talking about certified nursing assistants, licensed nurses.
A lot more medical care than you would get in an assisted living.
Right. And what Lisa just said is one of the biggest takeaways that I can offer today is, in a residential assisted living community, it's not a medical model. It's a social model. It's, the benefits are great, but they're not specifically related to medical. Skilled nursing you're going to look at absolutely.
And that you said that because I've toured a lot of assisted livings, and as we said, they are very different. I mean, some literally do maybe not no medical, but very, very minimal medical, and then some will do a lot. So just to get back to that, I mean, I think that's probably in all the categories, I think that's the one that has the biggest variance from community to community, don't you think?
I agree. I agree. Each organization is going to have a little bit different comfort level with kind of the medical options that they have, and they are all licensed to be able to provide certain levels of care. So you have to remember that there are prohibited health conditions in some assisted livings when it comes to certain types of conditions that they cannot accept, or they have to request approval before that they can accept an individual. So these are the kind of things that again, I know it's complex, because and I want everyone to hear from Lisa and I that it is complex. And here at the Glenner Memory Care Centers, we're very, very happy to walk you through these different types of care options, and that's really, again, what this show is all about.
And it gets back to, if you aren't sure what you need, like we said last time, is call our 800 number, and we'll help.
Want me to give the number?
Decide. What's the number? Do you know the number?
Yeah, I sure do. Well, let me just say this. I think that we want to be able to provide options, like Lisa said, and resources, right? I mean, we hear that a lot in the community. I know Lisa's doing outreach daily, and this is a confusing subject.
It is, and I threw a couple names out earlier, but we do work with many different and collaborate with many different assisted livings, memory care communities, home care agencies out there. So, and I have toured many communities, so I can tell the difference. Depending on what you need, I can help tell the difference for maybe what will work for you. So let's get back to, you talked about how much it costs, but how about how to pay for it?
Sure.
For assisted.
Absolutely. So you've got many different options when it comes to skilled nursing. So I'm going to kind of work my way back from there, because skilled nursing, you're going to look at, especially when it comes to short-term rehabilitation, which, here I go again, there's a kind of a breakout between in levels of care and skilled nursing. Some folks are only going to be there for short-term rehab. Perhaps they're there for physical therapy, occupational therapy, speech therapy. They're only going to be there for maybe a couple of weeks, could be a couple of months. Medicare may end up paying for at least a portion of that stay. And it's very important that you are familiar with what your benefits are, because Medicare, we hear this question all the time. All the time we hear the question, doesn't Medicare pay for this? The reality is Medicare certainly has its coverage, but there are many things specifically within long-term care that it does not pay for. So just to be clear, when you're looking at your Medicare benefits, there are certain things that will be covered. Specifically, the first 20 days of skilled nursing care is covered. But there's a caveat there, as long as measurable progress is being made. So if an individual has a situation that they're in skilled nursing, that the skilled nursing facility feels that they can cover under Medicare, there still has to be measurable progress in order for them to continue you under that stay. They have a responsibility.
So what happens after 20 days then?
After 20 days, if measurable progress is still being made, then days 21 through 100 are covered, but they have a copayment that is required. So
a daily copayment?
A daily copayment.
Wow. And then what about if progress is not being made?
Then they have to issue a notification, essentially a denial letter, and the individual has an opportunity to perhaps appeal that or look...
Private pay?
Absolutely. They can go to a private pay model at that point. And when you're looking at skilled nursing, and we didn't touch specifically on the prices there, but you could be looking at a minimum of $200 a day for skilled nursing care. So that can add up to $60,000-$70,000 a year if you're looking for 24 hours skilled nursing care.
And some people can be in skilled for years. Right?
Absolutely.
And
some folks are there under what we would call a custodial level of care, right? So that would be a situation where perhaps they are long-term under a private pay situation, or they're under some kind of government, certainly Medi-Cal or Medicaid if you're watching in other states. And the reality there is that the individual would have essentially a share of cost, meaning that a portion of their income is contributed to the stay, and then the rest is billed to the government organization. So, again, I think what's really important to note is that all of these levels of care, there's these same kind of key pieces, right? Knowing exactly what the coverage level is, knowing exactly what the cost is, and then knowing what insurance is available to you, and as far as what kind of cost is going to be covered. And so making that determination really starts with just being familiar with what levels of care there are. And I think that this is critically important for anybody that's specifically facing this right now. If you're watching right now and perhaps you have a loved one in the hospital or in a skilled nursing facility, and you, quite frankly, have not been exposed to this before, it's overwhelming. I mean, wouldn't you agree, Lisa? I mean, there's a lot to consider.
It's so overwhelming. I mean, I've talked to so many people that just literally don't know where to start, and literally don't know the difference between, and who would, right? If you don't, this isn't something you really go about researching or checking out just for fun. So most people are, when they're doing their research, they are already in a difficult, stressful situation and trying to make sense of it all.
And being pressured.
Anyways, and being pressured because then they need to get care right away, right? And they might be making decisions quickly. So, they are making, a lot of times they're making decisions quickly because, again, they're being pressured. Because they wait too long. They wait for
and that's just it. And I think, Lisa, and I applaud you if you're watching this right now and you've taken an interest to kind of understand. Again, some of this material is, if you will, it's information that is heavy. It's heavy information. It's you're looking at different levels of care that perhaps you've never looked at before. And again, I think one of the things and we really want to be able to do is help you decipher what these different levels are, because being a resource is important for us in this organization, and we want to be able to give those types of options. So let me just very quickly give a kind of a re-summary, Lisa, and then you certainly add anything that I perhaps missed. But again, so I think what the takeaway to all this is, there are 5 levels, right? So again, just as a recap, if this is kind of the final review of these options, you've certainly got your what you may be already doing at home. Kind of, we called it your do-it-yourself options. You've got home care is certainly an option, right, where you bring individuals into your home and look at options from that standpoint. Again, you've got adult day programs, right? These are things that programs, if you will, that can be very valuable from the standpoint of being able to drop your loved one off during the day and be able to pick them back up. And then you've got residential assisted living and residential skilled nursing facility, and the subcategories that we kind of talked through as well. So
we didn't elaborate too much on the memory care part,
right? Absolutely.
Actually, but we should quickly is that a memory care, when we say memory care community, it's essentially an assisted living or residential community specifically for people with memory issues. So that's all they do. That everybody in the community will have memory issues. So it's essentially a specialized assisted living.
That's right. Lisa's exactly right.
So,
and it gives and it's important because when you look at a large assisted living community, you want to be able to have individuals that are kind of similar functioning, if you will.
Right.
And so it's important to make sure that when you're looking at those options, that again, that you're well educated in that. So I hope that gave you a really much better understanding, perhaps, than just going online and looking. There are, literally millions of options out there. If you combine everything together, the amount of nursing homes, assisted livings, types of kind of sub-assisted livings, it's
a lot to weed through.
There are many options, and
yeah.
so this gives you an opportunity to really look through those options. So, if you have questions, please comment right here on this post. Certainly had viewers, which we appreciate today on Periscope, that dropped in. If you have comments and questions, please comment right here, and we'd love to get the dialogue going. And I recognize that people have had different experiences, positive or negative, with all levels of care. It is a challenging situation at best, and we hope to be able to give you again information that makes you certainly stop and think about those options, and then be certainly the most knowledgeable consumer that you can be, whatever level of care you're looking at. So.
Yeah, one thing I will say, just for another adult daycare plug, certainly, because that's what we do. But if you are looking for residential care, and since it is such a difficult decision, and people, it's not something a decision you're gonna make overnight. Mm-hmm. So adult daycare can be a perfect solution for almost a gap filler, if you will. I mean, we provide excellent care. They're being taken care of as with expert caregivers, and it just gives you a little bit of a breather to make that decision and to do your homework and do your research.
That's right.
So that's where daycare can also be helpful.
Absolutely. So Lisa, tell them about our viewers about the programs that we have coming up as we wrap up this edition of Tree Talk for March 1st.
Well, we have one in particular. It's going to be held at Frederica Manor in Chula Vista, and it's called Life After Diagnosis, Now What? So it's a perfect seminar that will talk about what we've talked about here today. It will give you different care options and help you make a decision after you've been diagnosed with some level of dementia. We'll have Dr. Dan Sewell from UCSD on our panel.
Should be great. Should be a great opportunity for him
awesome.
to come and talk with us.
Yeah, hopefully we're going to get him on the show.
Yeah,
right.
Yeah,
so
absolutely.
He's
Future
amazing.
Guest. I promised a guest this time, and I apologize. I didn't have an opportunity to bring a guest on this time, but
we had other questions and
that's right.
stuff. So
we had some good content this time. So when is the date on that one?
So
again,
it's March 25th from 11:30 to 1:30.
That's a Friday. Okay.
I also want to let you know we will have somebody from Sharp Mesa Vista giving information on clinical trials if anyone is interested in that. We'll, of course, have someone from the Glenner Memory Care Centers talking about our services, and then, of course, someone from Frederica Manor talking about their services at their community.
Wonderful. That sounds like a great program.
You gonna go?
I think I'm going to be there.
I'm gonna be there.
Well, we're both going to be there. So
Who would miss it?
That's right. I think we're excited to be able to bring these kinds of events to you throughout San Diego County. I think there's an opportunity for us to do some of these events online in the future. So again, if you're watching this, please let us know what you think. Please let us know what kind of information you'd like to continue to see. This is a fantastic opportunity for us to interact with our audience. Please like it, comment, share, and get the word out, not only about certainly our organization, which we're certainly proud of at the Glenner Memory Care Centers, and you can find us at glenner.org, but also certainly for others that may need the resources just in general. We want to make sure, I think Lisa and I are committed, we've talked about this in the past, we're committed to making sure that people have the right information. So again, this is an opportunity for you to do that. You can visit us on our website at glenner.org. You can go and again call us at 800-736-6674. So.
And I will just one more point about the upcoming symposium that we have at the end of the month is we would appreciate an RSVP. If you would like to join us, you can call our number or email us at info@glenner.org.
Perfect. All right. Well,
I think we're good.
Second episode's in the books. And so thank you so much for joining us today. And so we will see you next Tuesday at 3:00 p.m. And again, join us live here on Periscope or watch us kind of the repeat broadcast on Facebook. So we'll see you next time. Thanks.
Thanks.